Hello, welcome to For Your Head Media. My name is Miriam. I'm a nurse practitioner. What is diabetes? We're going to talk about diabetes today. Diabetes is a disease that affects the way your body uses sugar or blood glucose. When we eat starches, carbohydrates, potatoes, rice, and things like that, the body has a gland known as the pancreas gland. It has some beta cells that will help with the production of insulin, a hormone known as insulin. The insulin is what breaks down the carbohydrates so that the body can use for energy. Well, when someone have diabetes, for some reason, there's some kind of interference with that. So the person is not able to use that insulin well, or don't even have the insulin in some cases. So there are a few types of diabetes, but we're just going to talk about two today. Two types of diabetes, type 1 and type 2. Type 1 is known as juvenile diabetes. We used to call it juvenile diabetes, but now just there was type 1 diabetes, also known as insulin dependent. So in this case, it starts early in life, usually around maybe before 20 years of age. And for some reason, it's caused by what is known as an autoimmune. For some reason, the body has decided to attack and then destroy the beta cells in that pancreas gland that produces the insulin. So for this type of person, they'll be getting insulin for life. They will not be able to, the diabetes will not be treated by any medication, oral medications whatsoever. They will be getting insulin injections. And with this type of diabetes, it also comes on suddenly. So that is a difference between that one. Then the second one is type 2 diabetes, which is the major one that majority of patients, majority of people are having it. And this one is usually due to the fact that people, the body is not using insulin well, either because you are kind of overweight or you have what is known as insulin resistance. So even though the body is producing insulin, the body is not using it well to break down that carbohydrate so that the body can get that energy. So as a result, the blood sugar is always very high for you. So yes, they will say you have type 2 diabetes. So let's talk about signs and symptoms. You might have what is known as the 3 Ps. We call it in healthcare polydipsia, polyuria, polyphagia. Meaning you are either urinating too much, which is known as polyuria. Polyphagia, you are hungry all the time. Polydipsia, you are drinking water all the time. Or you just feel tired, and in some cases, sometimes you lose weight. Or if you have a cut or an opening on your body, for whatever reason, it doesn't heal because of that sugar, the sugar interfering with the healing of the wound. So a lot of the diabetes in practice, in my case, what I'm saying is that the person will not know they have diabetes. They will come for something else. And then I'll say, okay, well, let's just check you for diabetes and show the person will have diabetes. So sometimes the symptoms are not so clean cut. Sometimes the symptoms might be vague because other diseases could also show up in that with some of those symptoms. So how do they diagnose diabetes? When you come to the doctor's office, a lot of times you'll be hearing them say, oh, let's do your blood sugar. Have you eaten in the last 8 hours or so? They'll check your blood sugar and say, oh, okay, it's around 126. Some people will check it twice another day, or, to say you have diabetes. Or there's another test known as hemoglobin A1C. The hemoglobin A1C, what it does is that you don't need any fasting. They just check the blood sugar, and the blood sugar test shows your blood sugar in the last 3 months, 2 to 3 months. So what they would do is just get that blood, spin it, and then you will tell us. And the way we know to diagnose with that is that we go by numbers. So let's say they draw your hemoglobin A1C, and it's under 5.7. The result will say, oh, you don't have diabetes. You are scot-free. So continue doing what you are doing. But if we test your blood for hemoglobin A1C and is from between 5.7% to 6.4%, we say, oh, you are pre-diabetes. Another name for that we used to say is borderline diabetes. That means that you need to start paying close attention to your diet, exercise, being more healthy, because If not, you're on your way to getting diabetes. We don't want you to get to diabetes with pre-diabetes. We want you to go back to being normal. So when you have pre-diabetes, it's a sign. It's good for us to detect that. But the good thing for you is you can start watching what you eat and start doing that lifestyle change. Then the other way they could also diagnose diabetes is they give you some oral glucose, like 75 grams of oral, something with sugar in it, a lot of sugar. And then after you drink it, maybe wait 2 hours, and then they will check your blood sugar. And if it's maybe 200 or more, they will say, oh, you have diabetes. What are some of the risk factors for type 2 diabetes? Because for type 2 diabetes, is very, very interesting because most of the risk factors are modifiable. What that means is that if you take steps, you can prevent yourself from getting diabetes. So being physically inactive, sitting on the couch all the time, gaining weight or obesity, being overweight, eating food, like fast foods, junk food, fried foods all the time, things like that. And then, of course, when you are 45 and up, you are also running a risk of, getting diabetes. And also, if you have a parent or a loved one that have diabetes, chances are you are also at a high risk. So let's say you get pregnant. Every time you get pregnant, you have babies that weigh more than 9 pounds. They call it, you have what is known as gestational diabetes. So if you have gestational diabetes, you also have to be watching seriously because you are also at a risk for maybe developing diabetes in the future. So you want to watch that. So somebody has been diagnosed with diabetes. What is the next step? So then they will tell you, give you medication depending on the condition. You might just start only oral medication, and then of course you come back again for a checkup and things like that. You might see a registered dietitian so that they can talk to you about diet, and you might also be, giving a glucometer so that you can be checking your blood sugar at home, recording it, so that you come back with the results to discuss with your doctor. So diabetes is a very, very serious situation. There's a fast fact about diabetes, and what it says is that it's the 7th leading cause of death in this country, in America here. Also, diabetes is the #1 cause of kidney failure. Imagine that. And this is a disease that could be prevented, but then you see people, they have diabetes, before you know it, they're having kidney problem, before you know it, they're having, heart problem. So diabetes is the cause of that. So what are some of the things that we could do so that, we can prevent, in most cases, prevent from getting diabetes? The first one is what? Physical activity. How to be active. The expert always say about 30 minutes a day, at least 5 times a week or something like that. You want to start getting active, even if it's walking, jogging, whichever one you can do. If you go to the shopping mall, maybe park a few yards away so that you can walk into the shopping mall instead of parking right by the door. And if you get into that shopping mall, that is a very good place to do your exercise again. Instead of sitting in that motorized bike, you can just use your feet and walk around and do your shopping. So do more exercise. Then your diet, or the food that you eat. You want to try to stay away from junk foods, like fast foods, fried foods. You want to eat healthy. And that's why I say one of the things that you would do, what the doctor would say, is that you need to meet with a dietitian so that they can talk to you and discuss what to eat and what not to eat. So of course, even you yourself can make some changes on your own when it comes to taking care of yourself at home. You change, it's a whole different type of lifestyle. You have to change your lifestyle. You want to boil more, you want to grill more, you want to bake more, you want to try to stay away from fried foods, you want your food to be, your plate of food to look more like a rainbow, rainbow colors, meaning a lot of vegetables and, little meat here and then, a little starch, but you don't want your tray just to have all the fried foods and all this other meats on it. You also want to make sure that, you are resting. Diabetes is a very serious illness, but, you could do, there are many things that you could do to prevent. Because again, I forgot to mention, but diabetes can also cause eye problem, eye blindness, So remember to keep it in control. The best thing is to have a lifestyle so that you don't end up with diabetes. But if you do have diabetes, there's hope, meaning that if you watch your diet, you exercise, you take your medication, just remember, even though you have diabetes, you can still live a fulfilled life. I hope you enjoyed the topic. I would love to get comments from you about what other topics you want us to talk about. But don't forget, subscribe and like the channel and share too. Have a great day.